Welcome to Podiatry Practice Mastery. I'm going to go over kind of something that I really has helped me a lot in the practice. I like to go over and teach things. Some people actually say that I give away too much, but I like to help people, and I like to be helped, so I get a lot of good ideas from other people. What I want to share with you are I want to share exactly how I explain to patients and do my patient presentation on warts. And first of all, if you haven't seen my presentation, I know I had a hard time thinking that I could actually show slides to patients, but it's really helped me for certain conditions. Okay. If you don't know what the slide deck looks like, you can go to patientpresentations.com, just put your email in, and you can get a link and just go down to the one that says warts. And that's the current one that I use. That's what I'm going to explain to you. So I'm going to kind of talk you through it as if I'm talking to my patient. And I have been very, very successful with using this presentation for my patients' acceptance for Swift. So if you are struggling with getting patients or parents' acceptance for Swift, I hope this helps you out. So let me get right into it. Hi guys, welcome to the office. My name is Don Pelto. I'm one of the doctors here. How are you doing? Good. I can see that you've had this wart here for a while. What have you been using to treat it? It sounds like you've been using some salicylic acid, some over-the-counter things. You've seen your primary care, tried all the wart sticks and the wart sprays at home, and nothing's really worked. Does that sound right? Yeah. What I like to do when I'm with patients, I like to show pictures because I think it helps a lot to understand what's going on. So if you don't mind, I'm going to just pull up a couple of slides here that I put together. I used Google Slides, and I use these because it helps patients to see these. So if you look at this first slide, this is a picture of warts. There's different types of warts, and you can see yours looks very similar to this one on the side of the foot. There's those little black things in the center. Those little black things are blood vessels. So if you look at the picture on the left there are blood vessels going into it, and they are feeding the wart, but your body doesn't know it's there. And that's the big challenge with warts, is that they kind of stick around for a long time. And some of my patients, they have a question, do they have a wart or do they have a callus? Because they look very similar. There are certain calluses that are, I call them clogged sweat glands, or it feels like you're walking on a pebble. Those are called porokeratomas or IPKs. Those are different than warts. Sometimes they can be warts, but the main difference is the skin lines. So a wart is caused by a virus, and it has skin lines that are interrupted, so the skin lines go around the wart. And then calluses, they have skin lines that go through them, and they're caused by friction or pressure or different areas. So I think yours is a wart, but it has that hard skin, that callus skin around there. And everyone always asks me, where did I get my wart? And warts can come from the pool, the cut in the skin, wet or damaged skin, or from others who have warts. So it can kind of be passed from one person to another. Now I wouldn't worry about it giving it to someone else, but it tends to happen like at pools. A lot of swimmers get these, and people that have their immune system a little bit diminished. So how do you get rid of it? So I keep it real simple. So I tend to see in my practice a subset of patients that have had treatment somewhere else. So if someone gets better with home remedies, I find that they're probably not seeing me. I tend to see the more difficult ones. And what you want to do is you want to do anything that can cause an immune response to help your body to recognize it. Basically, you need to trigger an immune response to your body, send cells there and says, hey, there's something wrong. This is not supposed to be here. Let's fight it off. And sometimes it can go away, but if it's been present for 3 to 6 months, you should seek treatment with a professional. So I tend to see the subset of patients that have had it for over 3 to 6 months. If you haven't had it over 3 to 6 months, and if you haven't tried these things, there are some home treatments you can try. Some people recommend duct tape, salicylic acid, taping a penny, burning, cutting. Now, all of these are injuring it to stimulate your own body's immune response. In some of my patients, they ask me, well, can I just cut out the wart? Well, I will remove warts occasionally. If there's only 1 or maybe 2 warts, I'll remove them. And if you want the quickest treatment, so some, for example, college students that are home on vacation, they have 1 wart, I will cut it out. But you have to be aware that it could come back, and there could be scarring. And those are the kind of the 2 risks, and they tend to bleed a little bit, or actually quite a bit, depending on how deep you go. If you're in a rush, we can do that. I don't tend to remove too many on little kids. I tend to do them in older people. Now, I'm going to talk a little bit about something called Swift microwave therapy. So, this is something that's a newer treatment, and it is a handheld microwave. So, what it does is it speeds up the cure by about 50%, and it's about 85% effective with less than 1% recurrence rate. And so, what most traditional treatments, there's about a 10% recurrence rate. I'm not sure if it actually comes back or never goes away. That's my main concern is I think a lot of people, if the wart comes back in exactly the same location, it was never really gone, right? You didn't stimulate the immune response, your body didn't interact on it. So if it comes in a different place, then I think it maybe is a recurrence. But I think a lot of times if you don't get that immune response, they just kind of get a little bit better and then don't go away. And I think the culprit a lot of times are with like dermatologists. They'll see these and they'll put salicylic acid or they'll put something else on that, and then they say it's gone, but it really isn't gone, and it wasn't gone, but they say it didn't go away. So how does Swift work? So Swift, it's low dose microwave energy, and it's put into your skin, and it stimulates your immune system, and so that your body will attack the virus, and it resolves the lesion, the wart on there, and there's a lot much less recurrence for it. And the best thing about Swift is it's 3 to 4 visits, and they're 1 week, they're 1 month apart, and then you do a 3 to 4 month follow-up. So it is by far the best technology that's out there to treat warts. And I really, when I see people here in the office, I tend to give them 2 options. So regardless of the option, I like doing combination therapy because I think doing 2 things or 3 things or 4 things is better than 1 thing. So the way I think about it is if you want to get it better in like 3 to 4 visits, you would do Swift. So Swift is that microwave therapy, and you would do something topically. So topically would be either Carac cream, which is kind of a skin cancer cream to slough off the skin, or Aldera, which is made for genital warts, but you can also use it on a wart as wart. You can use it anywhere else, and then a pumice stone. And then if you don't want that, then the traditional treatment is either cantharidin, which is called Beetlejuice, which is a blistering agent that causes a chemical blister, or you can use laser to cause a heat-induced blister along with the topical. The main difference is that those can many times be 8 to 10 visits, and they have a higher recurrence rate or incomplete cure rate. And then the Swift is like 3 to 4 visits. So it's really up to you what you want to do. The main pros and cons of these at Swift is expensive. For the 4 treatments, it's about $1,000. Insurance doesn't cover it. You can use flex spending. But a lot of my patients these days are choosing it because it's less visits. But I find other patients, they want to do what is, I guess, supposedly the less expensive one. But if you look at all the office visits and the price of the codes that we use to destroy the wart, it actually tends to be more expensive if there's a lot more visits. So that would be the cantharidin. And the other thing with the cantharidin is that it has a big blister on it, and it tends to hurt for 3 to 5 days afterwards. Laser doesn't hurt as much. Laser hurts right now, but it doesn't hurt after. The Swift is a little uncomfortable doing it right now, but then there's really no pain afterwards. So those are kind of the options for you. What questions do you have? Things I can answer. So that is my explanation of how I use Swift. And I think the key component here is saying that Swift tends to be 3 to 4 visits, and cantharidin tends to be more visits, like 8 to 10 visits. And I think the time level, and so some patients, they're like, oh, let's do what insurance covers first. So if they say do what insurance covers first, I kind of explain the lesion destruction tends to be an expensive code, getting close to that 250 mark, along with the office visit and other things like that. I will also prescribe the Carac or the Aldera. I'll do that. That'll bump my at the office level visit for that because it's medication management. And then if they choose the Swift, I'll do the Swift that day. So that's kind of how I explain it to patients. If you haven't seen the slides or you want to see the slides, there are a couple of slides in the slide deck afterwards that go over the price of it, and they show some pictures. I don't tend to use those or the wart treatment evaluator. They're there if you wanted to try to use them. But that's what I find works best for explaining warts to my patients. So hopefully it will help you if you're having a struggle using or getting people have acceptance with Swift. Okay. If you have any other questions or if you want help getting better at this, what I would recommend is you go to podiatrypracticemastery.com/audit, do the audit, let me know how things are going in your practice. Once I get that, I will reach out to you, schedule a time we can talk through, and you can tell me any of your questions or problems, things like that with doing Swift or Shockwave or any of these other things that you're doing in your office. Okay, thanks.